Hi, my name is Ashley, and this summer I had the opportunity to intern at the New Orleans Child Advocacy Center, also known as NOCAC. NOCAC is a part of Children's Hospital that specializes in helping families that are reporting cases of abuse. The people that work at NOCAC all bring different expertise to the table. So there are forensic investigators, there are doctors, there are nurses, NOPD is a part of it, as well as Child Protective Services. And they all work together to form the multidisciplinary team. And this multidisciplinary team, also called the MDT, they have bi-weekly meetings to make sure that none of these families or children are falling through the cracks. So during my time as an intern, I had various responsibilities depending on the day and depending on the things that the center needed. So some days my time there was spent transcribing the forensic interviews so they could use them in their MDT bi-weekly meetings. And some of my time was spent just playing one-on-one with these children while different family members were being interviewed. And the bottom line was just to make sure that these families felt supported and heard and safe during their time at NOCAC. I learned a tremendous amount during my time at NOCAC because of the different professionals that I got the opportunity to work with. For example, I got to work with Child Protective Service workers, and one of the things they told me one day when I was there was that Louisiana has one of the lowest rates of placing children in foster care and out of their homes. And because I was so new to this area of abuse, I didn't really know what to make of this fact. Was this a good thing? Did this mean that the abuse rates were decreasing? Or was this not the case? And so the CPS worker told me that no, the rates of the abuse that was taking place was not decreasing, but it was more just that the cases that were being reported were not being reported as they should have been. So they gave me an example and said that in some parishes, certain violent tendencies in the home weren't thought of as abuse, but were rather they were normalized. So, for example, if a sheriff heard of someone down the street that they had known their whole lives and that they were abusing their children, they weren't very likely to further investigate this because they've supposedly known this person their whole lives and didn't think this abuse was actually taking place. And I also learned about different community outreach programs that NOCAC is doing. So for example, there's a program called the No Hit Zones. So this program works to advertise all around the community and in the hospital and in just the surrounding neighborhoods that no hitting should be taking place when trying to parent your children, or if you're a child on the playground or things like that, and other methods should be used to help your children for discipline. They also have programs where they work with the NOPD task force to teach them how to recognize and report cases of abuse so that things like I referenced before with the example with the sheriff did not happen. And one of the biggest things that I learned at NOCAC was the process of what happens when a family comes in to be treated for abuse. So when a family walks through the door, they are greeted by our team and sometimes interns like myself. And you make sure that they are met with the language services they know, which is something I will touch on later that NOCAC really emphasizes. So after they come through the door, they are set up with a forensic investigator, and the different members of the family that come in are all individually interviewed. So during these interviews, the FIs make sure that they use non-blaming, non-shaming, and non-leading questions to make sure that they get the whole story and understand what's happening either in the child's home or in their environment or community. And after the interview, the FI, the forensic investigator, deems whether it's necessary for the children to receive a medical exam. So if they think that it is necessary and that abuse might be taking place, the child then meets with one of our doctors that is on staff, who is specifically trained to investigate possible cases of abuse. So after this medical exam, the team works together and brings in other forces, such as Child Protective Services, to see whether what's the best route for this child to take. Sometimes the child is required to immediately be removed from their home and placed into another place with another member of their family, or whether they need to be placed in the the foster care system. And then the MDT also meets, like I said, bi-weekly to make sure that these cases are being followed up on properly and to make sure that the children are safe. So during my time at NOCAC, my understanding and outlook on abuse has greatly evolved. I grew up in a small town in a pretty sheltered environment where corporal punishment and abuse was not something I really came into contact with at all. So being around these kids and reading all these different cases made me realize that abuse is much more common than I originally thought, specifically in New Orleans. And there's the the statistic that is said that almost that 90% or a little bit higher of cases of children that have been either sexually or physically abused, the perpetrator is somebody that they know, either in their home or someone in their community, and not a stranger. And I knew this going in, but it really became extremely evident to me how true this was after reading through hundreds of cases where 9 out of 10 times the child would report being abused by somebody that they had known. So this was extremely sad to me that caregivers who are supposed to be supporting their children and making sure that they feel safe and heard are often possible abusers for these children. And so throughout my time at NOCAC, one of my jobs was to go through different accounts of abuse and interviews with the forensic investigators and read through them and make sure that the child was receiving follow-up and what they call victim advocacy, or VA. And there were a lot of horrific accounts that I read. And so one of the challenges that I had was how to best read these cases and be empathetic and figure out how to help these kids without getting too attached and involved with the case. And so I learned how to work with my coworkers and decompress while at work, so it didn't affect my ability to help these children. So that was one of the biggest challenges that I encountered, was building this wall of protection of my own ability to help these kids and not getting too invested in the case. Another challenge that I encountered was having a language barrier with some of the patients that came in. There's a growing Latino population in New Orleans, and so, for example, one time a family came in and they had 3 young Latino children who did not speak any English, and it was my responsibility to play with them for about 30 minutes and make sure they had food and could use the bathroom and things like that, and this was rather difficult because I am not a Spanish speaker. And so I learned how to use my resources at NOCAC to make sure that these children were helped and supported. And so NOCAC works really hard to have bilingual services available. And so they have Spanish speakers that are on staff at all time to make sure that they can translate, as well as a really cool technology where they have phone translators. And so the phones have the ability to translate almost any language. So this is something that was almost unheard of in New Orleans up until Hurricane Katrina, actually. One of our readings touched on how Hurricane Katrina gave New Orleans the opportunity to better their primary care system and to introduce behavioral health centers such as NOCAC to the community to make there be an option other than going to the emergency room, which is often very scary for people that are already in such a vulnerable position in these abuse cases. And another part of the readings that was really interesting included bettering the education system. And so I think that one of the biggest things I've learned with my time at NOCAC is just really getting rid of the stigma that surrounds abuse and making it so that people are more likely to come forward and report these abusers, even if they feel scared. So NOCAC is there to make sure that these kids feel like they can be heard, and that's something that cannot always be true in their houses if they're in an unsafe situation. So during my time at NOCAC, I've gained a lot of knowledge about abuse, and it's helped really open my eyes and help me apply my public health knowledge in such a real-world setting and make an impact on these families that live in our own community. And so my contribution has really just been to see these kids and help the multidisciplinary team, which has so much on their plate, and just make sure that these kids can go forward and be in a safe environment and feel loved as every child should in their home. And so this is something that I'm going to take past my hours at NOCAC and help implement and help educate my peers in my future communities, whether that's New Orleans or far beyond. Thank you for listening.